Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. In this segment, we'll be speaking with Dr. Christopher Flowers, joining us here from the Department of Lymphoma, Myeloma, Division of Cancer Medicine, and Chair of Lymphoma and Myeloma at the University of Texas MD Anderson Cancer Center. He's going to talk about the recently approved Polivy as a first-line treatment for adults with certain types of diffuse large B-cell lymphoma. Welcome to Health Professional Radio, Dr. Christopher Flowers. Thank you for joining us.
Thank you for the invitation.
Well, why is this approval of Polivy so significant for patients that have been newly diagnosed with DLBCL? How did it change the treatment landscape for this condition?
Diffuse large B-cell lymphoma is the most common type of blood cancers. It represents about 30% of non-Hodgkin's lymphomas that we see in the United States. And it's a kind of cancer that if left untreated, is uniformly fatal. 92% of people would be expected to die within a year without treatment. But with treatment, it's a kind of lymphoma and a kind of cancer that is very curable. And so with the standard therapy that has been out there, a therapy called R-CHP, which is a combination of 4 chemotherapy drugs, cyclophosphamide, adriamycin, which has another fancy name and starts with an H, vincristine or Oncovin, and prednisone, the steroid pill, combined with rituximab. That standard therapy, approximately 60% of people are cured of their lymphoma with approaches. And over the last 20 years, since the approval of R-CHP, there have been multiple attempts to try and improve upon that standard of care to be able to improve the cure rate. The trial that I was a part of and one of the U.S. leads for the POLARIX trial was a trial using the combination of polatuzumab vedotin. This is an anti-CD79B directed antibody drug conjugate with R-CHP, so dropping that O drug or the vincristine and substituting the polatuzumab. In this double-blind randomized trial, what was found is that the POLA-R-CHP regimen improved progression-free survival versus R-CHP and is the first new approved therapy for first-line diffuse large B-cell lymphoma in 20 years. The main improvement that was seen here was an improvement in progression-free survival. And we know that progression-free survival is an important endpoint for patients with diffuse large B-cell lymphoma. Essentially, if you look at progression-free survival at 24 months or 2 years after the start of treatment, that relates to the fraction of patients that were cured. And if you look at this POLARIX trial, in this study, the standard therapy with R-CHP, 70% of patients who received R-CHP had progression-free survival at 24 months versus 76.7% of patients who received the POLA-R-CHP regimen. So that was an improvement of 6.5% in that study. This was first published by our group in the New England Journal of Medicine at the end of 2021, and that's now had additional follow-up that shows that benefit continues for patients.
Is this compound effective no matter when the DLBCL is diagnosed?
This is a first-line therapy for diffuse large B-cell lymphoma. So this would be the first treatment that is used for patients and produces that 6.5% improvement in 24-month progression-free survival. Another way to look at that is looking at over the course of the whole therapy, and that results in a 27% reduction in the relative risk of disease progression, relapse, or death versus the R-CHP. But this is a first-line therapy for patients. A few years ago, I was part of another study that used the polatuzumab drug for patients with diffuse large B-cell lymphoma when it comes back. And that has also been shown to be another way in combination with bendamustine and rituximab that polatuzumab can be used for patients who have their lymphoma come back. And that's another place where this drug is also approved.
Have side effects been reduced, eliminated, or do they remain basically the same as in historical treatments?
Fantastic question. And I think that's one of the things that we saw in the POLARIX trial is if you look at the adverse effects that were seen in the study, the POLA-R-CHP regimen had really similar toxicity as the patients who received the standard R-CHOP regimen. The things that we did see is that there was a higher rate of neutropenia or lowering of the white blood cell count. That's something that can be addressed by using growth factors to help to control it. There was not an appreciable difference in the rate of infections between the two arms of the study. This was a double-blind randomized controlled trial where there were patients, about 430-some patients in each arm of the clinical trial were randomized to each group. And that randomization led to be an equal distribution by age, gender, and other major demographic and disease factors.
Is there anything that you'd like to add for our listeners? And then give us a website where we can learn more.
So I think this is an important finding for patients with diffuse large B-cell lymphoma, seeing this benefit in progression-free survival. And as I said, progression-free survival is something that relates to the cure fraction of patients, and so an important benefit for patients. I think one of the things that we've also found from other research that I've done is that waiting for an overall survival benefit in a first-line clinical trial with diffuse large B-cell lymphoma would take approximately 10 years. And so seeing the progression-free survival benefit is the best way that we'll see benefits of new therapies in diffuse large B-cell lymphoma. There are a multitude of other things that can be given as downstream options for patients when and if their lymphoma comes back. But the POLA-R-CHP regimen provides patients the highest likelihood of having progression-free survival in the first-line setting. If people are interested in more information about lymphomas, the two websites that I generally recommend are two of the patient advocacy organizations that help to support patients with lymphoma, and that's the Lymphoma Research Foundation, or lymphoma.org is their website, and the other is the Leukemia and Lymphoma Society, and that's lls.org is their website.
Doctor, I appreciate your time with us here on Health Professional Radio this morning. Hopefully you return. Thank you so much.
Great. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Christopher Flowers. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. And be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.